How does freezing of gait, fog, affect Parkinson's patients? Imagine trying to take a step forward and suddenly feeling as if your feet are glued to the ground. That's what freezing of gait is like for many people living with Parkinson's disease. It is a common symptom where the person temporarily cannot move their feet despite the desire to walk. These episodes often happen during specific moments like starting to walk, turning around, or passing through narrow spaces or doorways. Usually they last just a few seconds, but sometimes they can go on longer, which can be very dangerous. Because of these sudden freezes, there is a higher chance of falling and getting injured, especially if the person loses their balance while their upper body keeps moving forward. Freezing of gait can really limit a person's ability to move freely and do everyday activities. It can be frustrating and even disabling, making simple tasks like crossing a room or going outside more difficult. This often leads to increased dependence on caregivers or the use of walking aids. Many people also find that freezing episodes cause anxiety and stress, which can make the freezing worse. Feeling anxious about walking can make the episodes happen more often, creating a cycle that's hard to break. As Parkinson's disease advances, freezing of gait becomes more common. Studies show that over half of people with Parkinson's experience freezing at some point, and it tends to be more frequent in later stages. In early stages, about 38% of patients may have freezing episodes, but this can rise to around 65% as the disease progresses. The timing of medication also plays a role. Freezing often worsens during, off periods when the effects of dopaminergic medications wear off. However, the exact reasons why freezing occurs are still not fully understood. Freezing is often linked with other symptoms like postural instability and difficulty with balance. It can show up in different ways, such as trembling in place, shuffling forward, or even complete absence of movement. Managing freezing involves identifying triggers like turning, walking through doorways, or multitasking, which can set off episodes. Patients are encouraged to use specific strategies, such as focusing on stepping patterns or using visual cues, to help overcome freezing. Adjusting medication, timing, and working with healthcare professionals can also help reduce episodes. Despite these approaches, freezing of gait remains a challenging symptom to treat completely. It requires personalized management plans and ongoing medical guidance. For many, understanding their specific triggers and practicing coping techniques can help improve safety and maintain independence. Remember, every person with Parkinson's is different, so what works for one may not work for another. If you or someone you care for experiences freezing episodes, it's important to consult with a healthcare provider to develop a tailored plan. In the end, awareness and proper management of freezing can make a significant difference in quality of life and safety for those living with Parkinson's disease.